Well, everyone, as we promised, we'd have our friend Dave Rubin here, but he had to run do something else. And so we're going to have him, I believe, next week. Susan, is that correct? Next Thursday or something?
Yes.
Later part of next week. So
Tuesday next week.
Next Tuesday of next week. All right. So he's been rescheduled.
After we go to New Orleans.
Right. We still have Duncan Trussell coming in tomorrow. We still have Jessica Rose coming in. So it's all coming. So stand by. That will be our upcoming shows. But today, I've been wanting to do this for a little while, as always, and we have lots of guests one after another. I want to take a time to answer your questions. And I've got a lot to talk about today. I've got sort of a lot on my mind, trying to square out all we've heard. And there's a lot of stuff we've been kind of going through here, and we haven't had a chance to kind of equilibrate since hearing some kind of extreme ideas. So I'll tell you sort of where my head's at. And of course, we're taking your questions over on Twitter Spaces. So all you got to do there is raise your hand. Caleb has a little animated thing how to do that. You just request and I'll bring you up. And if you do come up, you're agreeing to be on multiple platforms, Twitter, Twitch, Facebook, YouTube, wherever we stream. There we are. There's the little animated pro thing. Join Spaces and then request. Let's get to it.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
Well, now here we are, just sharing ideas today. So I wanted to start out by telling you some thoughts that kind of clarified in my own mind. I've been coming under a little criticism for, I know you guys are also grateful for some of the people that I've interviewed, but people are very challenged or become angry that people with alternative points of view are being interviewed or, God forbid, allowed to be on a platform, which just that notion is kind of disgusts me. So as soon as somebody says that, I immediately want to allow somebody to speak. Now, I may not agree with them, and I may not have the argument at hand to be able to argue them down, but I'm certainly willing to sit and listen patiently to what they have to say. But I realized that people that are preoccupied with other people becoming paranoid and into conspiracy theories. That's the concern. They're going to become conspiratorial. They're going to start to have a conspiracy. That is paranoid ideation, guys. Now, some people are more prone to paranoia than others. If you are prone to paranoia, you will find conspiratorial way of thinking sort of almost automatic. Now, conspiratorial thinking is enhanced, is activated when people have the sense that information is being withheld from them. It's in the nature of paranoia to try to fill in where there isn't information. So that is very different than trying to change someone's opinion. It's very difficult to change people's opinion. There's a whole literature on that. There's even this sense that if you do change an opinion in one area, it might backfire and become more solidified in another area. Some of that backfire effect has been called into question, but one of the classic bits of literature on that was people who were being given information about the measles vaccine were finally persuaded that it was a good thing to do, and then they doubled down on their anti-vax rhetoric on other vaccines. So that's what happens. People, because people tend to, if you're interested in this, Dave McCraney, who I've interviewed on this stream before, has a podcast called You Are Not So Smart. And he's preoccupied with this, and he gets into all the details, and he speaks to Dr. Dunning and Kruger and all the greats who have come up with some of these ideas. And he has finally decided that the only way to change a mind, and it made perfect sense to me, is essentially the way we do therapy. The way we do therapy, we're interested in changing minds. That's what we do. We commune with someone very closely. We listen to them with our whole being, with our body. We reflect back to them an understanding of what they're saying and feeling, and then metabolize it for them a little bit. Maybe offer something a little back to see if they can handle that metabolized version of what they might be thinking. And you do that many, many thousands of times, and that's what moves people off a dime, off a position. It doesn't really help argumentation doesn't really help. Particularly not when people have very firm opinions. Now, changing the mind is not the same as reducing conspiratorial thinking. Those are two different phenomenon. Get that straight in your head. When I, 3.5 decades working in a psychiatric hospital, lots of paranoid folks in there of all stripe. And one thing I observed over and over again, if those people who were prone to paranoia even had a feeling that something was being withheld from them, forget evidence that something was being withheld, a sense that something was being withheld, watch out. The paranoia blossomed, and very hard to get them back from that, except by being open and honest and presenting everything. You'll notice how with the balloons, people have a sense that these Chinese balloons, there's something going on that we don't know, because there probably is. I mean, this is military stuff, secret
Nefarious.
stuff. Well, I don't know about it's nefarious, but I don't want to know everything the military is doing if it's not in the country's best interest. But people who have conspiratorial thinking will immediately fill that in with all kinds of ideas, whether it's alien, whatever, or it's Russia, it's China, I know what it is. You must stay with the evidence. And I understand when the evidence is seemingly scant or withheld, don't fill it in. Wait for the evidence. Wait for the evidence. So let me look at what you guys are saying here on some of the Restream stuff and also in the Rumble Rants. Susan, are you over there in the Rumble Rants?
Yep.
Okay, good. And I'm on the Restream. And of course, we're going to be taking your questions off the Twitter Spaces in just a second. Somebody named Nuts and Bolts said Jordan Peterson has a good video about how to have a productive debate with someone. Yeah, when you're having a debate with somebody, you're really not going to change the other person's point of view. What you're hoping is that somebody listening will adopt that point of view or that argumentation, or be, argumentation usually just sort of solidifies positions. It doesn't change people's positions. It's why when people go into therapy, you cannot tell somebody, don't you see what you're doing? You need to do X. That never works. It doesn't work, because in fact, what happens when you come at somebody who has lots of feelings of our type and you come straight towards them, their defensive mechanisms go up much more powerfully and they push back. Then they are not going to change. So people have got to get this through their head. And the fact that we are limiting free speech because of this misunderstanding is really a serious problem in my mind. People have to get this different. So it's something that's bugging me these days. All right. Super chat. Any relation between the Gates Foundation sterilizing women in Africa and India using vaccines and the drop in birth rates in the West post-vaccines? Stefan, I don't see the evidence. Again, we haven't really decided yet what we're looking at yet. That's one of my criticisms is we have not clarified some of this data. That's why John Campbell is always looking up at the camera incredulously with, trying to understand why governments aren't rushing to answer this. Now, maybe they're withholding it. I don't know. But the point is, clarity is not there. It's sort of trickling in from various sides. I mean, if you look at the medical literature, you can find things both ways, frankly. So until there's sort of a consensus, I'm withholding my position. So where do I stand with all that we've heard lately, right? So we've had some extreme positions on this show, including Naomi Wolf calling the vaccines a bioweapon. I have had some very complicated cases lately in elderly patients. I think I brought it up a little bit. But I have had patients where I could not use Paxlovid because of the complexity of other things being treated. So I have patients that are elderly, meaning 75 and plus, serious, complicated oncological or infectious disease problems on multiple medications that interact with Paxlovid who get COVID, all right? So these are the people that could get really sick really fast. And my hands are tied a bit, right? We don't have the monoclonal antibodies now. We may have lambda interferon coming up. I don't know if you guys are aware of this, but we've spent a lot of time on this show talking about the cytokine. If you look back a couple of months, the cytokine activation system and which interferons are involved with it. Lo and behold, pegylated lambda interferon which is one of the interferons we were talking about. Just give it straight away. Forget the cytokine system or having the white cells release it. We'll just give you the interferon, and lo and behold, it works. So that is in my back pocket now for some of these complicated cases. But what I want to say is, in these elderly patients, which it is common as you get older to have multiple medical problems and be on multiple medication, it is common. I can keep people alive well past 75, but things happen like COVID, tuberculosis, cancers, makes it complicated. It's not like treating a 60-year-old with maybe hypertension with Paxlovid. It's very different. Now, I have used it many times in the elderly who are otherwise well with quite good results, a little rebound, that kind of thing. So I am a fan of Paxlovid in the populations where we know what we're doing, which is over the age of 65. Under that, it gets more complicated and we don't really know what we're doing. Some evidence that it might be useful. In a young person, I don't really see it. What's the matter, Susan? What's the matter? I will take calls. Let me finish my thing. Let me finish my deal.
Here's one now.
Yeah, people get through my do not disturb no matter what. But okay, I see you guys requesting there. I will get right to you. But let me just finish this. I have to straighten everything out. What I want to say is, because a lot of stuff gets said on this program, and I just, we listen, and now I want to straighten it out. What I want to say is, in those patients that are over 65 years old that have complicated situations, you cannot imagine how reassuring it is to have them vaccinated. All this sort of nonsense about people where Steve Kirsch put up a big thing today that vaccinated people are more likely to die. Not in the elderly population. I'm sorry. One thing I've learned to rely on over and over and over again is my clinical experience. Clinical experience trumps research, trumps evidence. It just does. Now, we can be wrong with our clinical experience. Don't get me wrong. I'm always prepared to be wrong. But clinical experience is something that is telling us something. And what I'm telling you is, in the elderly populations, having vaxxed and boosted makes things so much better, particularly in these very complicated situations. And it gives me sort of a margin of safety. And I assume it's cellular immunity to the T-cell mediated response. Watch Monica Gandhi. She talks at length about that. It gives me a margin of safety to get these people safely through. And I now have a 100% track record with doing so. Some were on Paxlovid, some were not. But it is a different day in terms of being able to manage these things, and is a different setting when these older folks are vaccinated. Of course, it's Omicron, which is also part of the different setting. Does that mean I support vaccinating a 30-year-old and boosting and keep going? No, it's a different situation.
Or an infant?
I'm still confused why our regulatory bodies would recommend it. I don't get it. So I might be missing something, and I'm prepared to adjust my position, but I don't get that. And if a 30-year-old came to me and wanted advice, we'd sit down and talked about it. And he or she, particularly he, the ones I worry about, would be the one generally making the decision, because I wouldn't say you need to do this. So it's challenging.
I don't think we would have gotten the vaccine if we didn't go to Greece.
I wouldn't have.
Yeah.
I wouldn't have. I was relying on my natural
because you
immunity.
had COVID.
I had COVID. I knew that natural immunity was a good thing.
I mean, I felt better once I had the first, first round of Pfizer, second round. But the booster, I just did it sort of impromptu. And
this is the other thing. You got to, I'm going to get to the questions, I promise. You've got to come to terms with the fact that adverse reactions are still rather rare. I would submit unacceptably high, particularly given that you don't derive enough benefit for me to understand why you would take it, but it's still rather rare. So kind of keep that in mind as we there's time to make these decisions. Could I be wrong on that one? Could there be much more going on than I realize? Yeah, could be. And I'm prepared to accept that as well once the data clarifies itself. But think about how many billions of people have received this, and that we're seeing thousands of problems. We're seeing thousands of concerned things that we're trying to understand. Is that related to the vaccine? And I would agree, as we've discussed many times on this program, that relative to other vaccines, we are accepting unacceptably high problems with this vaccine for uncertain gain, particularly in the day of Omicron. Now, if there's something happening that I don't see with Omicron, or with the vaccine changing, morphing, mutating, that they're worried about, I get it. But
people aren't dropping dead.
People aren't dropping dead.
Yeah,
they are dropping dead.
They aren't.
They aren't.
Yeah, it seems like it. It seems it's just it's treatable.
Oh, from Omicron.
Yeah.
Yeah, but they seem perhaps to be dropping dead from the vaccine. That's the concern. Yes.
Yeah,
or no?
right.
Are there excess deaths? This is the thing that John Campbell keeps asking. Are there excess deaths? Is there not excess deaths? What, and if there is excess death, why is there not a rush to figure this out? And by the way, the excess deaths are on the order of where we were, in darker hours of COVID. And then one of the really interesting things I want to point out, and then I'll go to calls, I promise, which is that COVID compared to a year ago. So Super Bowl was a year ago. I think I brought it up in the show once before. So 1 year ago, we had a mask mandate in this county, in LA County, for the same level of COVID that we have right now. That's the insanity of what we were into. Insane. It did nothing. And you see now, without a mandate, are people dying? I saw Rachel Maddow, when she was looking at the State of the Union address, went, oh, why aren't people wearing masks? There's a bunch of old people in there. Did we have a mass outbreak? Did people die after being in the Congress that night for the State of the Union address? Are there thousands, hundreds of cases, people dying? Is that what she implies? And people don't think that through. Zero cases, one mask. Bernie Sanders, good for him. He wants to wear a mask, fine. He wore the right kind of mask too. So that's where we're at. So, all right, Susan, did I make sense?
Of course.
Of course.
The pandemic
that's always true.
is over.
Yeah, so
The pandemic
President Biden said it
is
himself.
over.
He's right. The pandemic piece is over. It's endemic now. It's endemic, meaning, and I saw Twitter again, people go, I can't believe I'm wearing a mask. I got this thing. It's like, yeah, everybody's
Yeah,
gonna
but
get
why
it.
aren't they?
Everybody.
Why didn't he mention anything about the vaccines, like how it's killing people?
Well, because we don't, you can't say that yet. I don't know that that's true. But here's somebody who's.
I think a lot of people on our restream think it's true because they've witnessed it.
There's certainly an unacceptably high, in my humble opinion, amount of side effects given the benefit that there's no significant benefits to be derived. So I'm worried about that. And are there sudden deaths? I want to know what got Damar Hamlin. If that was a pulmonary embolus, that was the vaccine. I'm sorry, that's what it was.
Or COVID.
No, if it was a heart attack or an arrhythmia, it could have been COVID. If it's a pulmonary embolus, unless
Only
he
you know
had
the
COVID
difference.
actively, unless he actively had COVID, which I don't believe he did. Ups and downs. There you are. What's going on?
Hi, Dr. Drew. Hi, everyone.
Hey there.
I wrote in the little comment section, and I was actually on with Sean Hannity a couple years ago. My mother passed away of Huntington's chorea, and I took care of her for about 12 years. And not knowing anything about it and going as we learned and that kind of thing. I took the flu shot after my mother had passed away in 2009, and I almost died. I had three infectious disease.
What happened?
Sorry.
What happened? Why did you
I almost died.
Of what?
I wound up in the hospital. They said that I was allergic to the flu vaccine.
That
second
happens. That happens. Some people
Yes.
are allergic to the vaccines and they should not take it.
Yes, and went into anaphylactic shock.
Yep.
This was at Eisenhower Hospital in Palm Springs or Palm Desert.
It happens.
And and in doing that, I had three infectious disease doctors that were actually there at the time until they put it down to the fact that I had taken the flu shot. You are not to take another adult vaccine because is what they told me, because I also have other allergies. I have allergies to penicillin. I have allergies to aspirin, that kind of thing. So when I was on with Sean, I asked him, I said, as far as the blood supply. So now we're looking at people that went and got vaccinated and going like they should to go and donate blood, everything like that. And now all of a sudden I'm driving down the street. God forbid something happens to me. I get rushed to the hospital.
Well,
I get donated blood.
All right. So that is very different than the components of a vaccine that causes allergy. What's in the donated blood is the spike protein, right? And we do have concerns about the spike protein. Don't get me wrong. This is another question that absolutely needs to be answered. But allergy is not the issue. What will be the issue is the spike protein at sufficient concentration to cause all the toxicities that we're seeing, the menstrual irregularities, the depositions in the adrenal glands, the cardiac toxicity, the neural toxicity. Ryan Cole has a ton of data on this, where the spike gets deposited. Now, Can your body, I started thinking about this morning, can your body clear the spike protein? Maybe. Maybe. I'm assuming it does. The question is how long and what are the risks in the meantime? Now, obviously, Dr. Cole is looking at people that are post-mortem, and they seem to have died of something related to that spike protein issue. Now, that, though, is, again, not blood supply concentrations of spike protein, but the seeming phenomenon of the mRNA vaccine causing unrestrained production of spike protein in certain individuals, which is probably a different issue than what you might be exposed to in the blood supply. Now, obviously, the blood supply is being used the way it always has, and it's not as though we're seeing the same kind of post-transfusion problems that we're seeing post-vaccination. So we will keep an eye on that. We will keep a significant eye on that. All that's got to be done. Thank you for your question. This is Itana, I think. Itana. And I'll warn everybody that the coming to the podium here, it's a little bit glitchy with Twitter Spaces. So you have to always, once you get up there, make sure you unmute your mic. So now's when you unmute your mic, because it tends to mute itself again once you get up to the speaker's podium, so to speak. Yeah, I want us to be very, very careful, not hysterical and not paranoid. Careful in what we say and what we come to understand. Itana, you're still muted. There you
Hi,
are.
Dr. Drew.
Hey there.
Can you hear me?
I do.
Hi, thank you so much. Full disclosure, I work for Naomi Wolf and Daily Clout now. I joined her team a few months ago, and I just want to say I really appreciate the wide range of voices that you invite onto your show. And I've been following you for a long time. I think it's really interesting the way that everything has evolved. In terms of kind of moving forward, people who were against mask mandates for children, let's say, were called selfish for being against masks, but the people who were against the mandates fully believe that the other people were selfish for expecting children to mask on their behalf.
Right.
How do you move forward when there's two such different perspectives and you just don't see it the same way?
I think there's sort of two things that come to mind for me. One is you have to keep advocating on behalf of reality, right? Reality comes to bear. That's the one thing I've noticed when people get into ideologies in outer space and religious kind of thinking. Just keep reiterating reality. And then understand there is a thing going on right now where people have a sense of look, we all have narcissistic traits right now. And these narcissistic traits are causing people to have these grandiose, expansive sense of their own purpose and their wisdom and their desire to put things on other people, to demand other people either silence or wear masks, whatever it is. And if there is sufficient unison of reality to bear, you must get everybody together and go, stop it, cut it out. You're hurting these kids, stop it. And that's it. And just don't go beyond that. Because again, all I have is my experience in the psychiatric hospital. And whenever people would get like this, we would bring 5 or 6 staff together and we go, stop it, cut it out. You're spinning, just stop it. And they immediately stop when you have a show of force. It's kind of, and they get wounded because it exposes their grandiosity, exposes them to shame. And they feel, wounded by it and stuff. Like they get over it very quickly. Just stop, everybody. Let the kids be kids. This isn't doing anything. There's no compelling reason for it. Just keep reiterating the reality. Do you agree?
Thank you. The problem I have with that is that the people who should have been in the position to be the force that stops the masking of children were the ones who were enforcing it, or at the very best, not, passively just saying, well, there's nothing I can do about it because the Board of Education makes the rules or whatever the case may be.
But for instance, imagine getting a group of parents together and just going, stop, cut it out. You're not helping. You're hurting our kids. Stop it. I mean, just that kind of unified, very firm hand goes a long way. You'll be surprised. It's just like, what are you doing? Stop it. You're hurting them. Let's get going. It's a
Well,
pandemic now.
I think you're that voice. So thank you very much. I
All right.
appreciate you taking all the calls.
All right, I appreciate it. And keep getting the reality. Let reality come in. Keep looking at the data. Keep looking at reality. My goodness, if there were compelling reasons to do that masking of children, I'd be all about it. Are you kidding? What? I mean, think about how other people are thinking. What is? You want to hurt other people? You want to hurt kids? You want to hurt teachers? What is this? There's not even a slight risk benefit. There's not a slight chance that the risk benefit comes down on the side of doing it. That's the reality. And so if people are mandating it, you have to kind of ask them to please stop. Please stop. All right. Us take, yeah, I know. Someone's putting, imagine being a deaf child and everyone wearing masks. Yeah, it's unbelievable. Well, I guess you'd learn look, people are very adaptable. I think we'll get out of this. People on autopilot need to wake up and live in the now for sure. Reality, live in reality. Let reality come to bear. We've been through some very, very strange times. And we continue to sort of do that. Just try to keep your feet square on the ground. Let's take a little break. Back with more calls after this. Not sure how to say I love you this Valentine's Day? Well, nothing says I love you more than a few minutes of relaxation, and Genucel Skincare does just that. Gives you the luxury gift of feeling like you spent the entire day in the spa, all while, in fact, in the comfort of your own home. Susan loves to feel pampered and special, especially on Valentine's Day, so why not relax with a detoxifying mask and feel amazing after only one use?
I know I'm a snob about the products I use on my face. Everybody knows it. Every time I go to the dermatologist's office, they're just rows and rows of different creams. Retinols, vitamin C cream, under eye cream, night creams.
Scrubs.
And then when I get to the counter, they're overpriced. All kinds of products that you can all find at Genucel.com. I've fallen in love with this product at a fraction of the price. I've been using Genucel for 6 months now, and I'm very impressed.
Genucel's mask works wonders by pulling out all of your imperfections to make you feel refreshed and looking like you just stepped out of a facial appointment. Order the Dr. Drew package today and try this amazing mask for free. That's right, every single Dr. Drew and Susan package includes a free mask to celebrate you and your loved one on this Valentine's Day. Go to Genucel.com/Drew and enter code Drew for an extra 10% off your entire purchase. Plus, all orders are upgraded to priority shipping for free. That's Genucel.com/Drew, GENUCEL.com/DREW. Despite the U.S. blowing through the $31.4 trillion debt ceiling this January, the White House and the government still refuses to reduce spending. When it comes to fiscal responsibility, you can't afford to bury your head in the sand. Now would be a great time to consider gold with Birch Gold. In times of high uncertainty and instability, gold is king. Birch Gold makes it easy to convert an IRA or 401k into an IRA in precious metals. Here's what you need to do. Visit birchgold.com/Drew to claim your free information kit, the info kit on gold, and then talk to one of their precious metals specialists. Think about this. To dig our country out of this mountain of debt, every single taxpayer in the country would have to write a check for $247,000, and of course they're not, so it's only getting worse. Protect yourself with gold today by visiting birchgold.com/Drew. That is BIRCH gold.com/Drew. With an A+ rating with the Better Business Bureau, thousands of happy customers, and countless 5-star reviews, you can trust Birch Gold to protect your future. Here's what I want you to do. Visit birchgold.com/Drew today. All right, we're back. We're taking your calls. Let's get somebody up here. Mary wants to come up and ask a question, comment. We see you over in the Rumble Rants. Thank you guys for participating there. Yes, lots of interesting stuff going on. Okay.
Our restream is being glitchy, so
Yes,
you're going to have to
apologize for that.
talk to people on Twitter.
I'm asking Mary again. She fell back out. That's the kind of glitchy thing we're dealing with. I see the request. I will try to get to you guys. I promise. We have time to do that today. I think I'll be talking to Michaela Peterson later today, which should be interesting for her podcast. I haven't heard anything otherwise, Susan, of you, that we're going to do that. Mary, unmute yourself there, and we'll be able to... There you are.
Hello, Dr. Drew. Thanks so much for taking my call.
Mm-hmm.
My name is Mary McDonald Lewis. I happen to be a national board member for SAG-AFTRA, Screen Actors Guild AFTRA, but I'm calling today in my capacity as a member of that union. Our offices have been closed for 2.5 years, shuttered, closed. no employees in them nationwide. We have offices in New York, Los Angeles, Chicago, and then all across the country. Obviously, on set, vaccines have been required. There's been heavy testing and so forth. Our offices are now open as of only the past few days. But proof of vaccine is still being required, and masks are still being required to enter those offices.
Wow.
They've asked us to use the Clear app to demonstrate proof of vaccine. I would just love to have your comments on that, and I wanted to obviously express my support of your
Just ask them to please provide the data. I'm guessing there are attorneys making these decisions. And when when attorneys make decisions, reality bears no issue. What they're trying to do is limit liability. So even the perception of harm, like let's say somebody gets a bad case of COVID, no one can say they weren't doing everything possible at the SAG-AFTRA offices. I'm sure that's what it is. Those attorneys need to be addressed and dressed down, for that matter, for the disproportionate behavior requirements of the office. I mean, just exactly what expert are they consulting with? This is always my question to these people. Who told you to do this? What infectious disease expert thought this was a good idea? Tell me, not an attorney. I understand you're trying to limit liability. Fine. Now talk to me about the evidence you use to make that decision, other than you're afraid of liability. So that's always my question. Look, I brought up many times, I was sitting on a set doing a news broadcast when the LA County School Board came in, one of the members, and said he was going to close the schools down. I said, who told you to do this? Did you consult with somebody? Was there a infectious disease doctor involved in this decision? No, it's just the right thing to do. That's an insane response. That is insanity. And we have to move back from insanity. That's all I'm saying. But I understand. I'm sympathetic, by the way, though, Mary, I'm sympathetic to people trying to limit liability, because guess what? There's craziness on that side too, right? I'm sure there are people that are they're making crazy allegations about all kinds of things. And so I get it. But at least they should be maintaining a level of diligence that the average business maintains, let's say. And what they're requiring on sets is expensive and way over the top for reasons I don't know. But maybe those attorneys have an argument. If anybody's an attorney out there, please let me know. I would love to hear. Thank you. Thank you, Mary. I would love to hear what
I just think they have too
is.
much money to spend on this stuff, you know? They could be like feeding
Nobody has too much money.
starving children with all the money they spend on COVID tests. Like,
exactly.
Jesus.
This is Jenna.
But that's showbiz.
Hi, Jenna.
Yes. Hi, Dr. Drew. My name is Jenna Burns, and I'm here in Austin, Texas. And they murdered my husband in the hospital with the protocols of remdesivir and a ventilator back in September of 21.
Sorry.
And they are still using this protocol. And my question is, why are they still using it? Why are people still believing that all these people died in the hospital when they really didn't die from COVID? They died from the type of care that they got.
I have not seen compelling evidence that remdesivir is that big of a problem in terms of what you're describing. I've seen evidence that it's not terribly effective, and it's not great for your kidneys, but having some transient renal failure is not going to cause somebody to die. On the other hand, hold on. On the other hand, the aggressive use of ventilators was clearly a problem and clearly not the proper approach. Now, I wasn't there when your husband, unfortunately, was put on a ventilator, but you are absolutely right that oxygen damage and pressure damage was not all, but contributed to what was going on in so many people that were on ventilators. And you'll see they're ventilating a lot less now than they did then. So I don't know how you address that. I don't know how you get any kind of justice for that kind of thing, because people were in a state and they were doing the best they could. But as usual, this is very pertinent to the vaccine conversation too. It's like we in medicine have the potential to do harm, and we have to always weigh that out. And during this pandemic, we backed off that thinking, it seemed to me, and just were following these very repetitive sort of pathways, these protocols that really were not in the best interest of the patient. And Jenny, your husband, is unfortunately one of the casualties of that reality. And I thank you for your call. We have to kind of keep going here, but thank you for coming up and talking about that. Here's a physician. I want to get him in here, see what he's got to say about that. Geriatric physician. And maybe he can help me too and refine my position. Gerodoc, you're connecting. We're not there yet. We'll get you there. I'll look at the restream in the meantime. Okay. All right. Everyone's getting very excited about what
I'm
happened
curious,
to,
Drew.
yeah.
This is Caleb. Curious.
Listening.
So people
Yeah.
were asking questions in the comments. So what do you consider to be like the definition of rare whenever you're saying that it's rare to see side effects to the vaccine?
I would say it's a great question, and that's the number I want. I want that number. But let's put it this way. Billions of doses, not billions of side effects, clearly not
Right.
billions,
Right.
not hundreds of millions. I don't even think significant millions, maybe millions, but certainly thousands of thousands, right? And that compared to, the reason I brought that up is because I wanted Susan to relax. Oh, where'd that Gero doctor go? He was just there.
One death is too many.
Yeah,
Remember that?
Well, yeah. Remember when one death was too many? That was on the
Right,
COVID
exactly.
side. One death is too many. One death is too
Right.
many.
And the
Yeah.
tune
Well, now
suddenly
we've got some
changes.
question about deaths. Yeah, and the diathesis changes here.
Because they're not going to admit they're wrong.
But when I brought that up, I was trying to calm Susan down, hoping other people would calm down as well, realizing that the probability of her having serious side effect is low. I worry about it. We had one son that took an extra booster, the bivalent booster. I didn't think he needed it. He
I
took it.
mean, maybe I had a side effect, but I'm already brain dead. So,
All right. I'll try you again, Gero doctor.
it didn't seem any different.
It's like when I think about that, it's like I always try to remind people I got the mRNA vaccine, I got the boosters, I was totally fine. When I got COVID, it was nowhere near as bad as other people I knew who didn't get it. But however, I also know at the same time, even 1 in every 10,000, that is a huge number. Like, and for that one
It's a
person
huge
in every
number
10,000, that's a destroyed
Well,
family.
if it's
So
a young
I try to-
athlete or a
try to
child,
understand
it's
it,
like
you
It's
know.
a huge number that's a huge number if the rate of serious complication from COVID is 1 in 100,000.
Right, exactly.
If it's a factor of 10, well, now I'm listening. Now I'm interested.
Right. And that's
Gero
separating
doc,
this
you're still
conversation
connected,
from
Reverend.
like, the ideas, what Naomi Wolf was saying and the people talking about how it being a possible bioweapon, separating it from that conversation itself and just
Look,
looking at the numbers.
Yeah.
The reason
1
I
in
didn't push,
10,000,
the reason I didn't push back on that is I don't really know what that means. She has proven herself right in many situations where I thought
I
she was
know,
wrong.
she's like clairvoyant.
So I'm just listening. And so my position is, I don't think she's right. I hope she's wrong. I'm not gonna assail her position.
You
It
know
sounds
what?
well, but-
I just have to say something.
Yeah.
A friend of mine's friend had a
Mm.
baby recently,
Mhm.
and the minute the baby was born, they asked if she would like to give the baby the COVID vaccine, and she was like, no, thank you." And they were very aggressive with it, she said. And I was like, my goodness.
Yeah, on
like,
birth.
I mean,
At
come
birth.
on. You don't even know if the baby's healthy yet. Like when it comes out, you're gonna I mean, you wouldn't know if it was a congenital or the COVID vaccine. That's just so weird to me.
So Caleb, I'm having a technical problem here with the Twitter Spaces. There's a guy named Gero Doc here. He keeps coming up, and I keep trying to pull him up here. If I invite him as a co-host, is that possible to bring him
I'm
up
going
that
to try
way?
to, I'll bring him
you're
up
the
on my
co-host.
side here.
All right. Well, I just brought him up as a speaker. Hold on. Let's see what, and then you can try next time. He keeps very diligent. He keeps coming back to.
Note to Elon
make an
Musk. Let's
effort.
work on Spaces next.
Oh my God, yes, because some of these guys like Mario Nawfal has got these 10,000, 15,000, 100,000 people in a Spaces.
Crashes all the time.
See if it crashes all the time. Go, you try it this time, Caleb. He's up there requesting to come in. Okay, maybe Caleb can bring him in, and then we'll get to some of the rest of you here. I see you.
It's loading.
Yeah, I see that. I'm just looking at who else we have lined up here to give people a chance. Okay. I'd say Dallas is up next. If I can get, if Gerodoc doesn't connect this time, I'm going to pull somebody else up. Well, I want to give him a good chance of coming up here. So I can look at the restream in the meantime. Because people are very, very mobilized by some of these problems. And I get it. Again, I get it. I understand. I'm sympathetic.
I just feel like things are getting swept under the carpet now. They're
Mm,
not, you know, we're still reporting it, but I just think that people are going to get tired of it and just
get tired of
the COVID talk or just getting the answers.
and then just sort of cave
I
to
mean-
what the recommendations are.
I mean, in 10 years, we'll have more data and we'll go, oh, yeah, that was a bad idea. But I'm surprised that we're not more aware of it because it's such a new vaccine.
Yep.
And we should be getting every detail that we can and have it all documented just
Yeah.
so that we know what's going on. It just blows me away.
All right. I'm bringing Dallas up. Let's see if Dallas can get connected. There you are. Dallas came right in. Dallas,
Hi.
hey, what's going on there?
Sorry, you might hear my 2-year-old in the background. Well, I wanted to call in because I'm a new mom. I'm 28. I became a mom during the pandemic, and I'm also becoming one of those paranoid people that you talked about at the beginning of the stream,
Okay.
to the point where it's like debilitating.
Oh.
Like yesterday during the Super Bowl, I've been so afraid of these Chinese balloons that I thought something was going to happen, and I refused to leave my house. And it's just upsetting that
Yeah. So
I've
were
never
you
been like this in my life.
right? Were you like this before you were a mother?
No.
Do you think that the child has something to do with these feelings you're having?
Yes, I'm
Yeah.
terrified of anything happening
Right.
to us.
I think that's what's escalating this for you. Susan, do you want to speak mom to mom about that? 'Cause I
Oh
know
my
you-
God, that baby's so cute. I mean, I think that I got a text from somebody who was telling me the same kind of thing, and I was just like, oh my God. And I am worried too, but the paranoia doesn't need to be so extreme because
I would say also
being fearful of what probably isn't going to happen isn't going to make you happy in your life.
it's not going to make things better because
It's not bad. I mean, it's not bad to stay home,
we
but
are powerless for all that stuff. But I would just say that if a chorus of mothers would get together and again tell people to kind of stop the BS, I'm starting to hear things like that now, where people that are moms are going, "I'm going to school board. I'm not going to allow this anymore. Let's just stop it. I got to protect my kids.
no,
or
but
I'm taking them home."
she's fearing
No,
World War III.
I understand.
She's not fearing she is
get
fearing
it.
for her child, which I would too. But
So what she wants is two things. I want more information, real information from my government so I don't freak out about what I don't know. And I want you to protect me. I want you to show me that you're protecting me. That is not a lot to ask.
yeah, they're not very transparent
Dallas.
right
That
now.
is not a lot to
because
ask.
it's military stuff.
And I think you should ask for it. Just stand up with other moms and just go, hey, we need to know some things because we're trying to protect the next generation here, and it's affecting us. It's making us sick the way you're behaving. And it really is. I'm not surprised. I'm not surprised.
So how does she do that? Like Facebook or
I don't. That's good. Well,
I mean,
maybe you two can get together. I don't know. I don't know what the answer is, other than
Start
just
going
to
to the
have the
meetings,
intent.
school
At-
board meetings and things.
at least
yeah.
you know what?
Speak up.
Reach out to your friends also who have kids your age and try, like mommy and me's and stuff like that, and discuss these feelings because then you can build relationships with other moms who are dealing with probably the same
And
thing.
you know what? Somebody actually did. I don't know if you're inclined this way, but somebody on the restream did mention something actually that would work, which is if you have a community of faith that you could gather with and sort of feel a sense of purpose and communion with them, that will reduce a lot of this. It really will. That kind of feeling of turning it over and having faith, that can be very helpful when you're feeling like this. And if whatever that is for you,
right, or
think about
or
that.
like I said, like a mommy and me type thing where you go
Or a
and
church, or
you
whatever,
share your,
whatever that is, where you can.
like is this your first child?
Yes.
So she's not in school yet, right? So you're not
Right.
connecting with anybody till they're like 3.5 or whatever.
Yeah.
like 2
Right.
is a tough age because you're just sort of isolated in your home most of the time.
Yeah.
Yes.
But if you can get out, maybe go to a baby gym or something and just meet other moms and just, have an adult conversation, and while they're playing, and just tell your fears to other people, because it just really makes you feel better to be around other adults.
100%. And again, if
Yeah.
I had 3 2-year-olds. It was hell.
and in again, I want to just frame it that things like gratitude, faith, hope, turning it over to something, that all is very, very powerful and will help you reduce
Right. And
some of this thinking.
some churches have those kind of like mommy and me type things. Like I think I went to one once. It was fun to meet other moms and hear
But
their
Dallas, I'm just
concerns.
I'm playing the odds. We're going to be okay. Just playing the odds. Even Naomi Wolf said that after alarming everybody. She said we're going to be fine. So try to stay around to the people that can reassure you. Okay.
I think she wants
Thank you.
a career in radio.
Yeah. She wants to be behind the mic.
I think so.
She's like, I'm next. Can I talk, please?
Yeah. Well, thank you guys very
All
much.
right,
I
Dallas.
appreciate
You bet. You bet. I mean, so this kind of thing can be helpful. All right, we're going to try Gerodoc one more time. Somebody, by the way, Kayla put up a tweet where somebody said his wife, I guess, joined a mommy hiking group, and it saved. Oh, Gerodoc is connecting. There you are, my friend. You made it.
Hello. I don't know what kind of evil spirits have possessed Twitter for me today, so I'll just keep this really brief.
Okay.
I've been in long-term care, working in long-term care for almost 20 years, and I'm really quite curious. It's been a long 3 years for my residents.
Yep.
They have not been unmasked or seen their caregivers or family unmasked for the last 3 years. And I'm really wondering, is there any sign that this will end? Because, personally, just to tip my hand, I don't really see any net benefits to this arrangement, this ongoing universal masking whatsoever.
Yeah.
And in fact, I think it's harmful.
Yeah,
So
I agree. I think we need to, those of us with that opinion, need to kind of creep out of the shadows a little bit. I was with patients this morning, and all the patients wanted my masks off, but I had to maintain the theater for other doctors and other staff. So we have to, and by the way, some of the other people that I was protecting with masks have had COVID a couple times already, so I don't know what I'm doing. But I'm with you. I'm concerned about it. Hey, let me ask you this: what would you say is the average if you have somebody coming into long-term care? And I used to do a lot of work in long-term care too, both in dementia units and in regular nursing homes. What would you say now is the average life expectancy? Not somebody coming in because they fractured their hip and need some tune-up. People who are sufficiently deteriorated that they will need to be in institutional care the rest of their life. What would you say to somebody making that decision or family making that decision? And B, what would you say is their life expectancy after doing so?
boy, that's a tough question based on a whole number of things. I think the thing I focus on most is the change that seems to have taken place over the last 3 years in terms of the functioning of residents since the so-called lockdowns and all the mandates came down, which of course hit nursing homes very hard. There's a wide variety of skilled nursing quality you can get.
Yep.
And I would say that the evidence is starting to come out a bit that functional decline, deconditioning, increases in depression, and that's irrespective of whether a COVID, whether a particular unit or hospital, a long-term care hospital has been hit by COVID. That seems to be what's going on. I have a colleague who reported from just the other day, we were doing a conference call and reported that there's been an increase in excess death at her facility since COVID started. It seems to be independent of COVID status.
Right.
So, I think that I'm a lot more hesitant recommending people go into long-term care today than I was 3+ years ago. Used to be, I'd say, find it. Yeah, it's just, I think it's a really dodgy environment to be in. So
well, let me ask you this, and again, you've tilted at that there's a wide spectrum. I mean, that's it can go from really gruesome to kind of nice. That's true, and attentive too, by the way. But when it comes time for you, let's say you live long enough that you need institutional support, what's the plan for you?
Um, I married somebody younger than me. I don't know.
Is that to get her to put a pillow over your head? What are you talking about? What exactly do you mean by that?
Well, I think I'd like to say that I know enough about this business at this point where I could navigate the system, because it really is a system. It's the old Goffman-esque total institution thing. It's really become that way.
Yeah.
I feel like I could navigate it better than most, but honestly, I'd want to last as long as I possibly could in assisted living. There's a lot better ways to go in the ALF industry right now, and home care than being in the Medicare model dominated SNF industry.
No, I listen. I've just said, look, if I'm so far gone that I need two people to turn me and feed me and all that stuff, let's just get hospice and let's do it at home. Let's just if it's an intermediate kind of thing that I could come back from, or I have some quality of life and I've had a spinal cord injury or something, okay, maybe then. But if it's really total debilitation of aging, what are we doing? What's the plan here? Now, as they say, and you'll be well aware of this, is who wants to live until 96? Ask a 95-year-old.
Yeah. No, there are. Look, I think, for example, let's take the case of even potentially severe dementia. I've told people for years, it's a very scary thing for most people. It's possible to be happy and demented, to have pleasure, to enjoy yourself, but it takes work from the caregivers around you. And I just don't find it, the idea enjoyable if you don't know where you are, who you are, what's going on, that everybody's
and to be fair, Pix is very different than Lewy body, right? Lewy body is misery. Pix can be happy, so it's different. Or even frontotemporal can be sort of okay. So yeah, it depends on the kind of dementia. All right, my friend, thank you for calling in. I appreciate it very much. Oh, he's gone. So that's that. Okay, so Susan, you're getting active on the Rumble rants, I see.
Well, they were why did the doctors in your office? Okay, but here's my take on it.
I don't want to fault anybody.
I think if you're an internal medicine person and you have somebody who's sick and they come in the office and you want to wear a mask, wear a mask. Like that actually seems like the right place to wear it. Even though South Pasadena is the signaling capital. Yes. But also, like, all the doctors in all the offices I go to always have masks on too.
Yeah, it's sort of
and
theater.
They make you put a mask on.
Pretty much theater at this point, but I understand why it's kind of the last place to go.
No, but
it makes sense to me that...
I left my mask in the car. I had to go all the way back in the parking lot and get it because they didn't have it at the door. I was like, it's a medical office. If I don't have a mask, you should give me one if you're going to make me wear it. But it is annoying for the patients. But the doctors can wear it if they want, whatever. But they're sick of it. They're like, I'm just tired of this stupid thing, All
right, let me bring Dr. Mike up, who's got something to tell us, I think. We'll see what gives.
Magic Mike?
No, it's Dr. Mike. There you are.
How's it going?
Good. Seen you on for a while there. Sorry. Thanks for patience. What's up? Ooh, can't hear him. Do you guys hear him? I don't.
His sound is messed up.
Noise. So.
Oh, Mike. Sorry. We're going to...
Are you there?
Oh, there you are. There you are. What's going on?
Okay. Remember how monkeypox became a thing and then it didn't become a thing when kids and dogs started getting infected?
It became a thing and then it didn't become a thing. Okay.
When kids and dogs became infected. Now, it kind of disappeared. But remember back in the 80s when Fauci was looking at the gay community and you really got a deep dive into how HIV and AIDS was getting around?
How HIV and which and what?
AIDS was getting around.
Okay, yeah.
Like you really got a deep dive into the community, right? So
yeah.
Wouldn't we have gotten a really good idea how the kids were getting infected back then too?
With what?
HIV and AIDS.
Kids were still very rare, and it was all done. It was happening through pregnancy and breast milk.
Yeah, so kids were getting infected with HIV and AIDS, right?
Kids were getting HIV and AIDS, yes. So, intrapartum and breast milk was one of the concerns, yeah.
Right. So wouldn't the concern also be the same as the monkeypox vector?
I didn't see any kids with monkeypox. I mean, that was pretty much limited to one community as far as I could tell.
Well, right, but I'm saying back in the 80s when kids were getting infected with AIDS as well. Wouldn't it have been the same vector as monkeypox now?
What do you mean by this? But kids aren't getting it now. They'd have to have a mom that's infected, and that just wasn't happening.
Well, what I'm saying back in, like, Fauci would have known how kids were getting it back in the 80s, so wouldn't he?
We figured it out finally. It took a while, but yes, that was they finally got to it. Yep.
Right. So wouldn't have been what I'm getting at is why wouldn't kids be getting it the same way as they got monkeypox this year?
They didn't get monkeypox. They didn't really get monkeypox. Didn't happen. There was allegations that it was gonna happen, but it just didn't happen. It stayed in the gay community, and it ended there. They got everybody vaccinated up, and that was that.
But what about all those reports of kids and dogs getting monkeypox?
Yeah, it's apocryphal, as we say, not something that had any meaning to it. And if there was an occasional case or something, it just was, incidental. It was not something that is just happening. And at that point, to get monkeypox, you have to have contact with the pox. And that's different than HIV and AIDS, which requires body fluids. Very different kind of transmission. Okay, let's see what's going on here. Sorry, you guys want to get to you. This is moral and humanity. Let's see what that is. Moral and humanity. Sounds intriguing. And then I have to go pretty soon. I got to talk to our friend Michaela Peterson. There you are. What can I do for you? Boy, you're right, Caleb.
You have to remember there's a little delay. So.
No, I know, but they come up and some people jump right on and others.
So what you should do is click them up before you mention them and let them connect.
Okay.
Just click them up. You could have more than one person waiting too.
That is true. All right, well, I'll do that. Okay, put a couple up. Juicy Joy or something. Let's see what's going on there.
Hey, Dr. Drew.
Oh, Josh, hold on a second. I got another one ahead of you.
That's Juicy
Susan's
Joy.
making me put multiple
Juicy
people up.
Joy. Yeah, wait, and he'll get Juicy Joy first.
Okay, go ahead there.
Okay. Yes. I have lupus and everything.
Mm-hmm.
Now, from what I was told by my pharmacist about 2 years ago, actually, they were implementing that all your prescriptions had to be sent in electronically now.
Mm-hmm.
I'm assuming that was done so that if you're not sick, you don't have to go to a doctor's office.
No. It's just part of the electronic health record push to get control over the data and the bureaucracy of medicine.
Okay. But with my pulmonary cardiologist, I crack up because they still say, you're one of my youngest patients. You go in there and you got everybody coughing up a lung.
Yep.
I have to literally go in there every single time to pick up my prescription because they refuse to fax this in.
Are you in California?
I'm in Colorado.
Oh, see, I don't know what's going on in Colorado. California, you're not allowed to fax it in. You have to either do it electronically or on paper.
Right, and it depends on if it's which control.
Oh, if it's a controlled substance, the doctor has to sign up for a special electronic. I did not sign up for it because it's costly, it's cumbersome, and I'd rather just stay with the paper record. So I do it on paper now. But the regular stuff, that is just something that it's a new system now. You can't fax stuff in. Thanks for calling, dear Megan. I'm gonna bring you up in a second. Josh, go ahead and get to it.
Hey, Dr. Drew. So here's the thing. For me, when I listen to you talk to guests like Naomi Campbell, I get scared because I wonder if this is going to turn into just a purely anti-government thing, sort of like the guys who took over the Capitol and tried to say that Trump actually won the election. So there's a lot of anti-government thing. I respect Naomi Campbell. I think she's right. But because I didn't get a vaccine myself. I mean, I thought this was crazy from the beginning. I've never gotten a vaccine. The thing is I'm not out there saying that the vaccine is a pandemic itself. Yeah. It just seems crazy to me.
Yeah, I'm with you. Everything seems crazy to me right now.
Yeah, and I just, it's very hard, obviously. I'm I'm a minority in this probably, and you know, I'm not professionally speaking about this. She is, and you are, and a lot of other people are.
Josh, you know
But
what it is? Let me
Yeah.
put it this way. We're going to find out. You know what I mean? Like for instance,
Right.
I was having a dialogue with somebody recently where he was saying, you can't have these people on. They're creating paranoia. And I thought to myself, no, either he's right, allowing sunlight, allowing people to hear Naomi and Ryan Cole and things like that, is either making the paranoia worse or better. Now, my experience as 35 years in a psychiatric hospital, it's going to make it better. I believe that in my bones. So I'm willing to take that risk. But the reality is we're going to find out because I'm letting these people talk, and you know, we'll see. We'll see whether things get better or worse. I think I don't expect to change many people's minds because I know how impossible that is. But I do expect to reduce the paranoid thinking. And you see, we kind of chatted about it today with some of the people that were getting paranoid, and it's pretty easy to talk them down. It's really
I mean, the girl with the young child, for me, what that makes me think about is it's the child and her and no one else.
Yeah.
And if anyone else wants to help, they can. Otherwise, get out of the way, because that's the most important thing going on for her at that time and for her child.
And by the way, for all of us, what could be more important than that, right?
Of course. So what I'm trying to say here is there's two ways to go about life from my point of view. One is to be disobedient, like these guys who ran over the Capitol. The other is to say, maybe I can be disobedient to myself. Maybe my own views have gotten a little kooky, and maybe I can stand up to myself and say, you know what, that's wrong. That's crazy. I'm not going to do that.
I love it. I love the construct. And it's back to also what I was saying, like, stop it. See, stop it to yourself. Josh, I'm 1,000% engaged. I think that's
but the thing is we're going to feel guilt. We're going to feel guilt when we do it.
I don't think you will. You'll feel wounded. you feel some sort of shame, I think, more than guilt. And that's that's what I've seen over and over again. But thanks for that great idea. I love it. I'm running out of time here because I said I've got to talk to Michaela in just a second, and I want to talk to Megan before we get out of here. Megan, of course, is our mask expert whom I interviewed on my podcast that should be coming out in a couple of weeks. But you all haven't heard from her since I interviewed her a long time ago on this stream. But her messaging has gotten very clear. I strongly urge you to follow her on Twitter. She knows what she's talking about. And I actually have something to ask her.
Get the book.
What's her book?
Bodies of Others.
No. This is Megan. Megan Mansell. Hey, Megan.
Oh, hey, sorry. It's accommodating chaos.
Hey, I have a quick question for you. I'm watching what's going on Twitter and stuff, and I'm sort of trying to amplify some of your things. But the one thing that struck me was, and I don't think you saw this, a environmental biologist made a post about the Gesundheit, right?
Yes.
Explain to people what the Gesundheit is.
A Gesundheit is an apparatus that captures the forward trajectory of your aerosol emissions. It's like a big cone. It's like a megaphone backwards against your face.
And a lot of the masking data is come off of this Gesundheit showing that no significant amount of virus, or we can argue about that, there it is, but not that much is going forward through the mask. And your point has been that has nothing to do with what comes out from the mask on the sides, correct?
I actually responded to each of his posts on there as well.
Oh, I didn't see it. He was saying that the Gesundheit, he made a pretty good case for the Gesundheit being designed to capture the side plumes. And you're saying no.
Well, it's only 130 liters per minute, which is within the range of respiration. There is nothing to measure the outward side plumes. There's nothing to say. And also, one of the things that I shared on the data from it was that, okay, they tested with coronavirus, rhinovirus, and influenza, and somehow the aerosol. You can eat all three of those if you want to. Sorry.
This is that day. Because we're early. We're early today, and that's
to eat all three of these cheese sticks. So
yum.
But anyway, so the if you look at the data from the one that everybody's trying to use, magically, only coronavirus is captured by the mask. So the data shows full penetration or full capture of basically the same range of aerosols from both rhinovirus and influenza, but rhinovirus is smaller than coronavirus, so that doesn't make sense. What makes sense to me is that they used data from a time that the machine was malfunctioning or something. You can only eat them one at a time, baby. Eat that one first. Give me just a minute. Sorry. This is why my husband came home to watch them while I was on your podcast. Um, but what I want people to see with it, that also only did surgical masks, and at the same time, there's CDC, there's a CDC paper that was trying to assert a measure of source control. And I actually didn't even get on here to talk about masks. I had a question for you.
Oh, I'll get to it in a second. Give people your Twitter handle where they can see all the good information you put up.
I'm at Mamasaurus Meg, Mamasaurus Meg, MEG, on Twitter.
And again, to explain to people what you do. You do these environmental assessments. You have a long history of these very complicated environmental assessments. I don't know how else to describe it. Go ahead. You describe it.
My background's special populations. So making sure that, if you have somebody who's medically vulnerable or immunocompromised, that their accommodations make sense and that the people who protect them are actually protected should they have a pathogen or, if they have an aerosol generating apparatus that they have to use as part of their care.
And you have been ringing the alarm from the beginning that our mask approach was insane.
Much less hyper these days, as you pointed out.
Yeah, Susan, do you remember Meg when she was on the show? She was like, "I gotta tell you, I have to tell you." And I was like, "Okay."
I couldn't remember who it was, like the name, but I'm sorry, I forgot. But that was a long time on Dose of Dr. Drew.
It was a very long time
She and I did a whole careful analysis on the Dr. Drew podcast. Should be coming out in a few weeks. And then she went to town on Twitter, and so she's got a lot of good stuff up there. And it's just so clear. Before we get to your question, what about what we were saying? Somebody called in earlier, I don't know if you heard about how to address masking children and then the harm it's doing. What do you tell these people that are continuing the virtue signaling?
I've coached a lot of people on doing their school board presentations.
I figured.
And if people reach out to me, I will help them. I always make it a point to help people. But you need a united effort, and you need to point out, for one thing, that, okay, they're going to have local pediatricians go up there and say, we don't want kids getting sick, which they kind of have to say, but none of the local pediatricians are talking about how they are required to meet annually with an industrial hygienist for all of their fit, tested, prescribed, hazard-specific kit. And that every single apparatus you have ever seen on a child's face is unregulated, untested, and unsafe with zero efficacy, fit, filtration, term of wear, or medical clearance standards. Every single one of that. I didn't just pull that out of nowhere. I get that NIOSH standard from the CDC webpage. There are no approved respiratory protectant apparatuses for children. Children have different respiratory rates, different respiratory pressures, breathing rates than adults. And so what is, perhaps protective for you
also,
is non-interchangeable.
Not only that,
for
but
children.
what child is going to be able to keep the mask on sufficiently for it to be proper wearing, where there's even likely to be benefit from it?
What child could, properly don and doff an apparatus and keep it sterile for 8 to 12 hours a day? Children are gross. And so what the focus always should have been, especially for, this is all supposed to be about protecting the most vulnerable children out there. Well, what actually helps protect them is identifying them, figuring out who actually needs this added level of protection, because it is dangerous for some. And to follow the hierarchy of controls, which pushes environmental mitigation measures and it doesn't require compliance. It's about, air exchange rates or dilution destruction technology. And one of the things I was asking recently is, with the Ohio disaster and everything, Are they going to finally address that we need a hazard-specific response and that you can't just go outside in your N95 and be safe against vinyl chloride, you know? And that's what we always needed here from the start, but there was so much panic and so much guilt built into everything.
But it's that we need to. I was pointing out though earlier that the Omicron, the COVID percolating around in the environment is pretty much about the same as it was a year ago. And a year ago we were having mask mandates. So let's take a look at that and start to get some rationality going here.
And what I want people to understand is that the only reason it was ever pushed was under this false pretense that you wearing one protected others.
Yep.
You wearing an apparatus does not protect people from your respiratory aerosols. So this was right. eight months into the pandemic. This was readily accepted as an airborne pathogen, meaning aerosols, meaning matter that remains
and again, do not confuse it with a surgical mask, which is blocking spit with bacteria from falling into a surgical field. This is aerosol. It goes through
and
the environment in the air.
From like arterial spray or dental debris from getting into your
Totally different. Totally different. People are confusing all these things. Body fluids versus spit versus mucus versus blood versus airborne versus droplet versus aerosol. These are all completely different.
I actually did an updated version of my mini book after being on your podcast so that people could have the breakdowns that I was talking about regarding, we have the Cochrane review coming out now, and with everything with that, people are starting to understand that N95s didn't work, that surgical mask didn't work. I want people to understand why. And I also did some threads that I tagged you in on that, where, if we're breaking it down on output, and this is just based on what we know about this hazard right now. We could have more information come out later, and these could all be adjusted, within the given parameters. But what is currently available about output, about our particle to PFU, about our minimum effective dose ranges is that many times the required dosage is still allowed, even if you wore these apparatuses perfectly.
Yeah.
And so what the focus must be on is removal of the hazard.
Yeah. So you came in with a question. What's the question?
Yeah. And then I also had an anecdote after that, if you don't mind. It was about Bernie Sanders. But my question was, no one seems to be, you were talking about vaccination, and vaccination's not something that I closely follow. It's not my wheelhouse. I don't pretend it is. But there's so many different manufacturers of vaccines. There's so many different types at this point. And I wanted to know if you knew of anybody following research on manufacturer specific vaccine data, because I think that that's an important element that could be. We're not dealing with one vaccine. We're dealing with
and they're getting into lot specific, not just even manufacturer, but actually lot specific. So that is being looked at. That does get looked at. It's not widely distributed, but manufacturing is carefully followed. That's something the FDA does a good job at. They follow that very carefully. But in terms of which lot, and there's concern. I've been watching the COVID vaccine stuff more closely, and there's concerns about some of the kinds of spike proteins that are being produced, and some of the refinement of the mRNA that's in the particular vaccine versus one vax versus another. So I'm not sure that's settled science yet, but people are looking at those things. They are. So that's good. Tell us the anecdote. Whoops.
The other thing that I was going to say is my daughter's like howling like a banshee, but she's fine. She's there's not actually anything wrong. She just thinks it seems funny. But the other thing I was going to say was about Bernie Sanders with the photo. One of I had shared it in the chat group, but somebody had commented, and he's gotten a lot of praise that he was the only person still wearing a respirator. And the one
my
thing
question is, Megan, my question is, did everybody else in the room get COVID? Did somebody die in there of COVID? Everybody got COVID? Oh, nobody got COVID? Shocking.
My point was that he wasn't protecting anybody else. There's pictures of him that he had to keep taking off his glasses to wipe them from his exhale emission plume.
Oh.
And that's something that no one ever wants to talk
steams
about.
your glasses up.
Yeah,
but all that's
those are your respiratory emissions.
Right. Those emissions are full of virus. Right. That's you not protecting other people. And it's, by the way, you not being very well protected from other people either.
Yeah.
It's both.
Yeah. But the nose bridge plume happens even in a fully fitted apparatus. That's the escape.
He was just covering up the fact that he doesn't have any teeth left.
So,
oh no!
I'm kidding.
So people are asking, what are the studies that show masks don't work? There are 3 huge studies. One was in Bangladesh, one was in Denmark, and now a recent meta-analysis with the Cochrane analysis. Cochrane is the highest level of academic standing for a meta-analysis, and the Cochrane analysis showed no benefit. I'm sure you have other ones, Megan. What are the other studies you would quote?
I would quote the Conley RCT, which is the Canadian RCT, that basically showed there was also no performance difference between surgical masks and N95s.
Mm-hmm.
I think that's important because donning an N95 is far more restrictive than
uncomfortable,
and than donning a surgical mask. And and I think that it goes to show we're talking about mismatched apparatuses. And my point has never been, oh, there's nothing that can be done. There are things that can be done. It's just not what anybody is doing. And people like to call me an anti-masker, but usually you're not super specific about something when you're anti that thing. Like, I am trying to be helpful.
My dentist wears a gas mask when he works on
He wears a respirator.
And it's funny because we're friends, and when we say hello, we kiss each other. I take your mask off. I go, I just hugged you. Like, geez. But it's just hard because they're still wearing the trying to live up. I just saw this thing on my phone that said teen girls report record levels of violence, sadness, and suicide risk. CDC survey finds.
Yeah, not surprised. Shocking, everybody.
I mean,
predictable on
that's
day
what we
one
should
of
be worried
COVID.
about.
Predictable with the lockdown. Day 1 of lockdown, predictable. And why they didn't think about that is just awful to me. Terrible. All right. Well, Megan, thank you so much.
Good. Sorry for taking up so much time.
No problem.
Didn't mean to bum everybody's roll, but it's shocking that we're not more aware of that. We're not working on that. It just came out in the news. I mean, thank God somebody wrote this article, but USA Today. But that's what worries me the most is how we're harming our kids, and what the next step is.
Right. Well, we talked to a friend of ours that's in Washington, D.C. just now. They are beginning to sort of think about this. Of course, they aren't talking about how they caused it, but they're beginning to think about what needs to be done. And Megan, I wonder if we should did you give me all your references in an email once? Did I have that?
You there? I thought she was done talking and I took her off by accident. Sorry.
Well, Megan, but people can do followers.
Megasaurus Mom.
Mamasaurus Meg. Mamasaurus Meg. Go follow her, Megan. Put some data up. People seem to want the specific data.
It's the COVID shot.
So I know you've got lots of it, but again, there are the main studies. There are 3 sort of the studies that were most anticipated because everyone thought, this is how we're going to prove it works. The 3 biggest studies all were categorically no. Mask mandates do not work. Denmark, Bangladesh, Cochrane analysis. And so they get pushed away as soon as they show the different results than people anticipated. And that is a problem, everybody. Tracy, let's get you in here. We're going to wrap up pretty soon here.
It's always surprising. You pull them up and bing, they're like, oh, that's me.
Here they are.
It takes a second. There's a little delay.
Yeah.
So.
Molten Salt lost a job because of not getting the shot. Yeah. Boy, that
regular over on Rumble.
That restream is really
I know, everybody's really chatting it up today.
Tracy, unmute yourself. There's a microphone in the lower right-hand corner.
There she goes.
Here you are.
Hi, Dr. Drew.
Hi,
I'm
Tracy.
a big fan,
Thanks.
so thank you for giving me the time to ask a question. I'm a registered nurse for 30 years, and also had a severe vaccine injury from the H1N1 flu shot back in 2010, which led me down a big rabbit hole of finding out information I never dreamed of finding out. So I'm skeptic. I was skeptical from day one when this COVID jab came and started getting pushed on everyone. My question is, what has happened to the pharmacist? You know, why are the pharmacists comfortable promoting and vaccinating or jabbing people with a package insert that's blank? I cannot fathom.
You know, I'm
or
going to give
understand that.
that's an interesting question. I like it. I'm going to give a talk to the Board of Pharmacy in a couple of months, and I will ask them that.
Maybe you
and,
should get an example of it. Go to the pharmacy and get one.
and get the package insert.
Yeah.
It's blank because they have an EUA, right? And so we know why it's blank. The question is, how do they think it through? What do they think they're doing?
I mean, it's the holy grail for pharmacists. It's how they give informed consent. So I just don't understand how they can just put that aside and just give something they have no idea what's in it or what kind of ill effect it may have.
I will ask them. Thank you, Tracy. Appreciate it.
You're welcome.
Okay.
You're welcome. I'm looking for I'll be watching for that answer.
Okay. I will
Baffled.
try to get it.
I think when I got my first vaccine, though, I had a huge pile of paperwork that had all that stuff on it.
No, you probably signed to some kind of release, and a lot of people were not signing releases.
But I think there was a lot of stuff on there that I didn't read.
Of course. I'm going to try to get Dr. J up here and see what his or her point of view is. And I'll wrap up soon. My next thing was canceled, by the way.
Whenever you're, oh my God. Imagine that.
Relax. What's up there, Jay?
Hi, can you hear me?
Gotcha.
Hey, I'm actually a practicing psychiatrist, so I'm going to kind of keep my name a little bit anonymous.
Okay.
But first, want to thank you for everything you do.
My pleasure. Thank you for being here.
Yeah.
Hey, let me ask, before you go on, let me ask you, what do you think about my experience with paranoid ideation? So I'm very familiar with the literature on changing minds, and I think the way minds are changed is essentially the same process that people use with certain kinds of psychotherapeutic techniques, but you don't change minds with argumentation. But I have noticed that you can reduce paranoia with information, with just more information. The more people feel like they're getting the info, the less paranoid they get. Do you agree with that?
I'm sorry. I'm actually in my doctor's waiting room.
I understand.
The nurse just came up.
I understand. But the point was, do you agree that the more information you give people that are prone to paranoid ideation, the less they're up paranoid ideation?
That is debatable. I think it depends on the person how intense the delusion or the paranoia.
Yes. Okay, I beg your pardon. Excluding serious mental illness, excluding people with manias and schizophrenias, that kind of thing.
Yes.
I mean, people
providing more information and time.
Yeah.
Hopefully that does improve the paranoia.
Yeah. All right. What made you call in?
So I was just curious. Have you really tried to get any interviews with Dr. Krause and Dr. Gruber, the two medical or senior FDA officials that resigned due to the vaccines or the boosters? Because I guess this is debatable. I kind of feel like they almost owe the public a little bit of a direct interview and questioning as far as like historically what's been the protocol for approving these things, how it changed, and then ultimately why they either resigned or were fired.
Listen, it's a great idea, Susan. We have a crack booker that I will.
It's Dr. Krause or Gruber, you said?
Yeah.
Sorry, guys, I have to run.
Okay. Thank you. Great point. Thank you for bringing that up. We'll go after it. I thank you.
Stay well.
Yeah, man. Yes, get her on that. There, see, Caleb's got it up there on the screen. And you know who's been after this is Vinay Prasad. He's been talking a lot about it. And we should absolutely, it's almost irresponsible that I haven't thought of that before. Thank you. Be really, really,
Crack
really
producer.
yeah,
you know.
we'll get our people on it. And
I like when our guests produce our show. It's nice.
yeah. Oh, it's great suggestions. We are open to stuff. Okay, let me quickly go around the horn here with some of the comments. See what you guys are talking about. Marion Gruber and Philip Krause. Thank you, Michael. Marion Gruber and Philip Krause, Susan. Okay. I'm going to copy that to make sure I've got it myself. I've heard about them, and as I said, Vinay Prasad was very concerned about that, and he thinks they're two of the more upstanding members of that board, and was sort of shocked when they bowed out. Okay. And then finally, I'm going to look over on the Rumble Rant, see what you guys are up to. Got some Lyme disease patients over there, which is a miserable, frustrating illness. I understand. You might talk to the COVID long haulers guy if they are looking at Lyme and other chronic conditions like Epstein-Barr and things, and trying to think of ways to work with that. Dr. Prasad did an AMA where he thought we were too paranoid about the government response in summer 2020. I don't know what quite that means. Ain't woke, don't fix it. But we have been interviewing him a number of times on this show, and I recommend you all to, in terms of Twitter follows, Vinay Prasad, Monica Gandhi, Mamasaurus Megan Mansell. These are really good.
Did Meg ever get censored on Twitter?
I don't know the answer to that. Will Adam Carolla be making an appearance on the show? Salt wants to know. We could get him in here pretty easily, I think.
Yeah.
That would be easy. I don't know what we would,
I think you're going to make an appearance with him on Megyn Kelly on
oh, that's
a week or
right.
so.
So he and I are going to do Megyn Kelly together. That should be fun. Yeah. So look for a Megyn Kelly podcast, and when I get on that,
I think it's the 27th.
All right, we do need to wrap these things up, Susan.
It's her show. Yeah, her show's live on Sirius. So
I don't. Is it?
I think it's live on Sirius, but they also
goes
have
on
video.
Sirius.
But it's on the 27th with you and Adam.
Upcoming for us, Duncan Trussell tomorrow, Jessica Rose on the 15th. That's Wednesday. We rescheduled Dave Rubin to the 21st, and then Brooke Jackson on the 22nd. Then Kelly's got, of course, some more ideas down the road, and we will go for these two FDA officials as well. Thank you for your questions and calls.
You might see us on Monday for more questions.
Yeah, you guys have been great. I always love doing these shows. I appreciate the interaction. Thank you to the health professionals that called in and asked great questions of me. It's very important for me to hear from peers. I think the peers need to be talking, interacting, supporting each other.
Just like the moms should be interacting.
Just like the moms should be. It's exactly right.
We need more moms to come together.
I agree,
fight.
and I liked Josh's idea about telling yourself to stop the grandiose. Just hold it, stop. Look. One thing that I have learned over and again from this pandemic: hubris is the enemy, certainty is the enemy. Stay open to possibilities. Keep light on your feet, because the information may come in that suggests you're wrong, or maybe you're right. I don't know, but just stay open to ideas and data, because we still got a lot of questions, and we're still not where we need to be yet. Thank you all for being here. We appreciate it. Thank you, Caleb, for producing. Susan as well. We'll be in here tomorrow at our usual time, 3 o'clock.
It's all Caleb
from Austin with the great Duncan Trussell. We will see you then. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help. I recently brought a male sex toy similar to a fleshlight and thought vegetable oil would be a good lube to substitute, and it worked. The next day, my uncircumcised penis, there was a film on the head of my penis and some mild irritation. Can this cause any medical problems or complications, or should I invest in some real lube for future silicone penetrative adventures? Yes. Invest in lube. Isn't that sort of obvious? Didn't he answer his own question?
This lube makes my dick feel weird. What should I do? Don't use that lube.
and he even asked, Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment.